People confuse OCD with OCPD, but they're different. OCD is the abbreviation for obsessive compulsive disorder, and I've made a video regarding OCD, and you can watch that video in detail if you want to know about OCD in detail. Obsessive compulsive personality disorder, OCPD, it's a personality disorder and it is different. It's not OCD, but the symptoms are quite similar sometimes. So normally people they are not able to differentiate between the two, and there must be these are two different diagnoses, and there should be a differentiation between them. And so the purpose of this video is to create awareness about OCPD and OCD, the difference between the two. So it's a short video and I'll tell you about the main differences. OCD is a disorder in the chapter of obsessive compulsive disorder, obsessive compulsive and related disorders in the DSM. And OCPD, it is in the chapter of personality disorders in the DSM, which is a diagnostic and statistical manual of mental disorders. So what's the difference? You can see even in the picture, the man under OCPD, the man seems to be, quite handsome, looking good, wearing nice clothes. So it depicts that people are quite, you can say, perfectionistic. People with OCPD, they are perfectionist. They want things to be quite perfect. And they stick to schedules, they stick to organization, symmetry. So these symptoms are confused with those of OCD. These are the people who get aggressive. They have conflicts with their family and friends because they're quite perfectionist. So they have trouble due to their perfectionism, but they do not realize that they are acting different than other people, and that this isn't normal. They're quite aggressive due to their, obsession of being perfect, doing things on time, sticking to schedules, making lists, and, doing all this obsessionally, with an obsession. They're very perfectionist. And if we talk about OCD, there are different themes in OCD. It's not always about cleanliness and organization or symmetry. It can be about religion. It can be about sexuality. It can be about checking locks again and again. It can be an anxiety. It can be any unwanted image, thought, or urge that causes you anxiety, extreme anxiety, and you want to get treatment for this. You know that you have a problem. So this is the main difference between the two. Whether you have OCD or OCPD, do seek treatment.